So this discussion is going to focus on kinematics. So we're going to talk about what kinematics are and what aspects we kind of look at when we're kind of analyzing motion in the body. So just to give an overview, so kinematics specifically looks at motion description, and part of what we're going to study in biomechanics is describing motions and what are kind of the components of how we look at describing motions. We're going to look at the variables involved in kinematics. So what are some different ways we kind of look at kinematics when we're evaluating movement? We'll talk about terminology and what we're essentially looking at. So what kinematics, the study of kinematics, what it actually is it's a description of motion without regard to the forces involved. So when you're talking kinematics, you're strictly just looking at describing motion, but you're not worried about the forces involved. We know that with our body, when we move, there are, forces involved, whether they're internal forces or they're external forces. But here we're just strictly looking at just describing the movement, okay? And we'll talk about when we involve the forces, what that's actually called later on. Okay, so here's something that most everybody has probably already been exposed to at some point are the planes and axes of motion. So again, the simplest way to look at this is every motion that the body does occurs through a plane and it rotates around an axis, okay? So you can see in the picture here, we have both the planes and the axes illustrated, okay? So when we're talking about the planes, we have the frontal plane, which divides the body into front and back, okay? You can see the frontal plane here divides the body into front and back. You have the sagittal plane, which divides the body into right and left halves. Okay, and you have the transverse plane, which divides the body into top and bottom. So movement goes through a plane. Okay, so for instance, if we look at movements that would occur in the frontal plane, so here's the frontal plane right here, okay? So for instance, hip abduction and adduction would occur in the frontal plane. If you think about adducting and abducting your hip, okay? So if you just even do that motion now yourself, that occurs in the frontal plane. Now, perpendicular to that plane, okay, or at a 90-degree angle, is the axis. So we say that the movement goes through a plane and it rotates around an axis. Now the body has 3 different axes, okay? Again, I'm going to kind of give the alternate names for 2 of them because I think that's important because sometimes, people will use different terminology, so I want you to be familiar with both of them. So we'll just start with if we look at the frontal plane, okay? So if movement occurs in the frontal plane, and I'll use the hip as the example. So hip abduction and adduction occur in the frontal plane. It occurs in the frontal plane and rotates around the anterior, posterior, or the sagittal axis. So that's the axis that runs perpendicular to the frontal plane. So here's that axis right here, okay? It's called anterior posterior because it runs anterior to posterior. It's also called sagittal because, like the sagittal plane, it divides the body. It can separate the body into right and left halves. But that's the axis that corresponds with the frontal plane. So any movement that occurs in the frontal plane rotates around the anterior posterior sagittal axis. If we talk about the sagittal plane, so the sagittal plane divides the body into right and left halves. If we're going to stick with the hip flexion and hip extension occur in the sagittal plane, okay? If a movement occurs through the sagittal plane, it rotates about the medial lateral or frontal axis. So here's the medial lateral or frontal axis right here, okay? So the medial lateral or frontal axis is the corresponding axis to the sagittal plane. Okay, then you have the transverse plane here, divides the body into top and bottom. That rotates around the vertical axis. So there you have a corresponding, I always say this, it's always easy to determine if it gets confusing, and we'll do more with this in class and talk about it. The planes and the axes correspond to each other. In other words, at least if you know the plane, you will always know the axis. Okay, so the transverse plane, movement goes through the transverse plane, rotates about the vertical axis. Movement goes through the sagittal plane, rotates around the medial lateral frontal axis. Movement goes through the frontal plane, rotates about the anterior posterior or the sagittal axis, okay? So what I would tell you right now as a part of just going back and reviewing your reading, think about different motions, what plane do they occur in, and what axis of motion does that mean that they occur in? Okay, so next we're going to look at osteokinematics and arthrokinematics. So osteokinematics are basically the movements that we see, or the mass movements, okay, or the movement through range of motion. So for instance, if we look at this picture here, we look at this young woman, we would say she's abducting her shoulder, okay, or she's doing shoulder abduction. So again, make it a point to recognize what the joint motions are. So again, you know, most people in this class should be coming from somewhere where, you know, you've learned joint motions. Again, make sure you're able to recognize those, okay? But she's doing shoulder abduction, so she's going through that range of motion. That's osteokinematics, the kind of the mass movement, if you will. Over here, we're looking at arthrokinematics. Arthrokinematics are joint surface motion. So as we're going through these different ranges of motion, our joint surfaces are actually doing kind of, almost for lack of a better way, these little micro movements in order to create that mass movement. And you can see them all listed here. So you have roll, slide, and spin, okay? So we're going to define each one of these because what we want to be able to do later on, and this is important to understand both just joint motion in general, and for those of you that are looking to get into the rehabilitation sciences like athletic training, physical therapy, because when you do joint mobilizations, this is really important to know because this is what's going to dictate how you do this. Before we get into any of that, we're just going to simply define what roll, slide, and spin are. Because if you understand what roll, slide, and spin are, when we talk about surface relationship and movement that's occurring, it'll make it a lot easier. So roll is when each point on one surface contacts new points on another. So in other words, picture this, picture the distal end of the femur here, just having different points of contact, okay? So roll is when each point on that surface is going to contact new points on the other. Slide, so roll is one motion. Slide is a linear movement, okay? Now here's how slide is defined. Now listen carefully to this. When one point on one surface contacts multiple points on another. Now notice the difference in the definition there. So with roll, it's when each point on one surface contacts new points on another. Slide is when one point on one surface contacts multiple points on another. So that's different. So slide is a linear motion, okay? So one point, so if this were just to slide, now the joints in our body always do roll and slide. If this were just to slide, it would just be moving like this. So this one point, if all the femur were to just slide here on the surface, this one point here would just contact multiple points on the other surface. So this is slide. So here's roll. This is the way it's rolling. This is how it slides. Now the reason why both of them occur at the same time is so that our joint stays stable and stays in the joint surfaces stay congruent with one another. Spin is rotary motion. Okay. So one point on a fixed location basically rotates, and we know that we do have a certain amount of rotation, obviously, at the knee joint. So we're going to talk about this concept a lot more, but again, stick with those definitions for now. And this could be something that's a little difficult to grasp right away, okay? And I could help further with it, but make sure you at least get those definitions down and just think about it a little bit. And then if you still have questions or you want other examples, we can provide those. Okay, so still looking again, we talked about osteokinematics refers to movement description. Okay, so we have different types of motion. We have translatory motion or linear motion, and that's motion that moves parallel to an axis. So we see this here. Okay, this is just straight translatory motion or linear motion. So meaning that something goes from point A to point B, that it moves parallel to an axis. In other words, all points on one object travel the same distance and velocity, and they end up in the same spot. That's linear motion, okay? Rotary motion is when you rotate around an axis. So the difference here is that points on the surfaces are going to move at different velocities, meaning the farther you are away, that farthest point is going to move the fastest. So if we look over here, okay, this would be demonstrating rotary motion occurring at the elbow. Well, if we look at, say this is point A on the wrist, and this is point B down here on the forearm, point A has to move faster to get to these different areas. So in other words, all the points on the forearm aren't moving at the same speed. If you were to look at the speed here versus the speed here, to get to this motion, well, from here to here, this is a bigger distance. From here to here, it isn't. Therefore, this doesn't move at the same speed, okay? Whereas when you're talking linear motion, it's just all going. It all moves at the same speed. So you really either have linear or rotary motion. What we have over here is kind of, this is what we call curvilinear. So all curvilinear means is that it just doesn't move in a straight line, but you still have everything going from point A to point B, okay? Now, from a practical standpoint, to see some of this, okay, when we look at different motions and kind of describing what's going on, rotary versus linear, okay? If we look up here at the picture involving the sprint, okay, the body is moving linearly. So in other words, the body's going from point A to point B. Okay, so let's say he's running the 100 meters, okay? His body's moving from point A at the start to point B at the finish. He's moving there, though, via rotary motion at the joint. So while his whole body is moving linearly, his joints are rotating, okay? If we look down here, okay, again, same thing. The fist is moving in a linear or maybe a curvilinear fashion, okay? But his joints are rotating. His shoulder, his torso's rotating, his shoulders rotating, his elbows rotating to create the punch, okay? So there, when we kind of look at what goes on with the body, we're essentially looking at, again, typically, you know, these whole movements kind of moving us linearly, but we're getting there via rotary motion at our joints. Okay, now kind of just doing some things, classifying joints and kind of describing the motion, okay? And we'll talk about what we call degrees of freedom of motion or how mobile a joint is, okay? So first we have our uniaxial joints, okay? So we look at here a uniaxial joint. Some of the examples of a uniaxial joint are your hinge and pivot joints. So again, make sure to refer to your textbook. There's some examples in there that can kind of help support this as well. So uniaxial joints, some examples of those would be your hinge and pivot joints. So if we look here, for instance, at here you can actually see with this picture, you can actually see examples of both, but they're only showing an example of the hinge with this. So the elbow joint, for instance, is a hinge joint. That's a uniaxial joint, meaning it has 1 degree freedom of motion. Why? Because all the elbow can do is flex and extend. That's 1 degree. Okay. I said they're actually showing 2 here because, so here's the elbow joint, but you also have, if you look here, you can't see the other side of it, but you also have the radial ulnar joint, which is a pivot joint. So the radial ulnar joint is responsible for pronating and supinating the forearm, which is also uniaxial. Okay. Then we have biaxial joints. So we have a couple different types of biaxial joints. We have ipsoidal joints that you can see here. An example of that would be the wrist. You have condyloid joints. An example of that would be the metacarpal phalangeal joints. And you also have what's called the saddle joint. We have one of those at the first carpometacarpal joint. Biaxial joints have 2 degrees freedom of motion. So if we were to look at the wrist joint, for instance, which is considered an ellipsoidal joint, okay, you can flex and extend the wrist. That's 1 degree. You can also do radial and ulnar deviation, or also abduction and adduction if you're using that, but that would be the 2nd kind of degree of freedom. So you have 2 degrees of freedom at the wrist joint. Then you have triaxial joints. So triaxial joints have 3 degrees freedom of motion. Most commonly, what you look at there are your ball and socket joints. Okay, so a ball and socket joint, just that. The best example, as you can see, I shouldn't say just the best example, but one example to see is the glenohumeral joint. Obviously, the acetabulofemoral joint at the hip is another one, but at the shoulder joint, you can flex, extend, which would be 1. You can abduct and adduct, which would be 2, and you could internally and externally rotate or medially and laterally rotate, which would be 3. Now, another joint, which it's considered a non-axial joint, but movement can still take place, are what are called plane joints. Now, the plane joints we're talking about, at least in the example of this picture, are the intercarpal joints, okay? So there's movement that takes place between all of these joints. It's non-axial, okay? And typically what you see with plane joints are more like flat surfaces, okay? Kind of articulating with each other. Another area where you would see what would be considered a plane joint, P-L-A-N-E, would be at the facet joints in the spine, okay? If you look at the facet joints in the spine, those would also be classified as plane joints. So joint end feels and range of motion. So this is something that clinicians use to kind of, as one way to kind of determine if there's normal activity at the joint or if there's some type of pathology present in the joint, okay? So your normal joint end feels, okay? Normal end joint feels can either be hard, firm, or soft, okay? So depending upon the joint, the body part, and sometimes the individual's build, that could also impact joint end feels as well, okay? Now, pathologic end joints, the one primary pathologic end joint is what's called an empty end joint. So, for instance, if someone tears their ACL, we do what's called a Lachman's test, where we kind of try to translate the tibia forward. And that should normally be a firm end feel, because when you do that, the ACL should stop the tibia from translating. If there's no end feel, we call that empty, okay? Meaning that the tibia kind of just keeps going. I mean, eventually it would stop because there's still skin intact that would prevent it. But what you feel when someone tears their ACL is you feel that empty end feel where there's nothing stopping it really at the joint from coming forward. That's considered an empty end. That's considered pathologic. Empty is always pathologic. Now, the other pathologic end feels we talk about, and this sounds kind of funny, when normal isn't normal. So all that essentially means is when you have an end feel that isn't supposed to be there. So for instance, when you extend the elbow, okay? So if you extend your elbow, okay, you should have a hard end feel, okay? The reason why you have a hard end feel when you extend your elbow is because the olecranon hits the olecranon fossa and you have that hard end feel. If, say, there's a soft end feel or a firm end feel, what that would tell you is that there is something wrong at that joint, okay? So what I want you to do is think about the different joints and the end feels that you have. So hard is usually when you have when you're going to have two bony surfaces come together. So if you know you have two bony surfaces coming together, that's a hard end feel. A firm end feel is usually when you have soft tissue stretch, okay? So if you get soft tissue stretch, that's a firm. Soft end feel is kind of when the body contacts itself, okay? That's a soft end feel, all right? Another thing I want you to kind of look at, I'm not going to go through all these individually, but I want you to be responsible for knowing the normal joint ranges of motion. So if you look at page 15 in your book, table 1-2, those describe normal joint ranges of motion. So be familiar with those. Again, those could be things we'd be tested on, and as we kind of move into the different body part sections in this class, you'll be responsible for knowing the ranges of motion at those joints. Okay, we look at kinematic chains. Now, when we talk about kinematic chains, you can do activities that are considered open kinematic chains, and you do activities that are considered closed in a closed kinematic chain, okay? Open kinematic, in a situation where you're doing something in an open kinematic chain, It's what you're basically doing is you're looking to increase mobility. Now, with both of these, there's always going to be a trade-off between mobility and stability. When you do something in an open kinetic chain, you sacrifice stability for mobility. Okay? Here's an example. If we look over here at the woman kicking a ball, okay? This is an open chain movement. In other words, her foot isn't in contact with the ground, and she's going to be swinging her leg through. She's sacrificing stability. So think about it. She's going up on one foot. Okay, now for a healthy, uninjured person, shouldn't be a big deal, but you're still sacrificing stability. You're sacrificing stability to get greater mobility to be able to swing that leg through. Okay, that would be an open kinematic chain. If we look over here, this would be an activity in a closed kinematic chain. Okay, what you're getting out of this is greater stability. Okay, and you tend to get greater power and strength increases, but your speed and mobility get sacrificed. Okay, now that's not to say you don't have, the ability to move by saying you're sacrificing mobility, but you're not having as much mobility. In general, you're not going through as much range of motion and things of that nature as you would be going as freely over here. Okay, so this would be a closed kinematic chain. So you'll hear this a lot of times, particularly as it relates to exercise. There's exercises that involve open chain exercise and exercise that involve closed chain exercise. Okay, so basically a good rule of thumb is if the extremity is moving freely, okay, meaning that's not in contact with the ground and it can move freely, that's an open chain movement. Okay. If the extremity is in contact with something and your body's kind of moving over the extremity, so take for instance in this push-up position, okay, his hands are in contact with the ground, his body is moving over his hands and his feet, okay, that's closed chain, okay, so a push-up is a closed chain motion, okay. Let's take another example. So if I said to you, is a squat, any type of weighted squat movement, is that open or closed chain? What do you think it is? Think for a minute. So if you said closed chain, you're right. Okay, a squat is a closed chain motion. Okay, just to again help with your understanding of this, if you were doing a seated knee extension. Okay, so if you're a seated knee extension to work your quadricep muscles in your thighs, that would be an open chain movement because now your body's moving freely. Okay, so there's a difference between open and closed chain. Now looking at arthrokinematics, so we're going to talk about joint structure and function. So what we're going to do is, beyond naming joints and calling them hinge versus, pivot versus ball and socket, we're also going to do another joint classification. And there are three general types of joints. There are synarthrodial joints, there are antiarthrodial joints, and there are diarthrodial joints. Okay? So as we're looking at these three different types of joints in the body, there's three questions you ask yourself, and this helps you with determining what the different joints in the body are. The first thing you ask is there a joint cavity present? Yes or no? Okay. Second question you ask is, does it move? Because there's some joints in the body that don't move or don't move much at all. And that would be the third question is, how much movement takes place? Okay. Now, as we go through the different joint classifications, you're going to see why these questions become pertinent. So a synarthrodial joint, okay, the primary purpose of a synarthrodial joint is stability. So a synarthrodial joint does not have a joint cavity. So you ask yourself with these joints, is there a joint cavity? No, there isn't. Does it move? No, it doesn't move or does not move much at all. So again, the synarthrodial sutures in the skull, that's a joint. They don't move, okay? The syndesmosis at the ankle joint, okay? Those are examples of synarthrodial joints, okay? So the syndesmosis is a type of synarthrodial joint, okay? Again, there's going to be different types of synarthrodial joints as you'll kind of see and we discuss later on. So the key thing to remember with synarthrodial joint is they're fibrous joints, okay? They're very stable, okay? They're the most stable of all of them, okay? They're either, they're formed by, again, in the case of either fused bones or very, very fibrous connections at the syndesmosis joint at the ankle, okay? So those are your synarthrodial joints. Again, these have a great degree of stability related to them. Okay, so ampiarthrodial joints. So just as we said, so we're actually going to go through the continuum here. So the synarthrodial joints, their primary purpose is stability, okay? They don't have a joint capsule. There's really, in most instances, no motion that takes place, okay? At the ampiarthrodial joints, ampiarthrodial joints are kind of the in-between. They offer a degree of stability, but also do offer some mobility. Now, in this picture, we actually have two examples of ampiarthrodial joints. We have the pubic symphysis right here, okay, where the two pelvic bones come together, and we have the intervertebral joints. Okay, so the intervertebral joints are where the vertebral bodies of the vertebrae come together and they have a disc. So we ask the first question, okay, is there a joint cavity present? Okay, the answer there would be no. There's no joint cavity. In instances of ampiarthrodial joints, you're usually looking at cartilage filling those joints. Okay, so some either fibrous or hyaline cartilage. Okay, kind of another example where you would see this is the first sternocostal joint would be another example of where you'd have an ampiarthrodial joint. Okay, so there is no joint cavity. There is movement, obviously, that takes place, but not as much movement. Now, again, depending on the joint, there's more motion taking place at some than others. So, for instance, at the intervertebral joint, we obviously know our spine moves a lot more than, say, the pubic symphysis would. There's movement that takes place here, but not a lot. And in individuals where that joint becomes unstable, that could cause a lot of problems. Okay. So those are some examples, and that's what your ampiarthrodial joints are. Now, the joints that make up the bulk of the body or what we think of as joints are our diarthrodial joints. Okay, so with a diarthrodial joint, and you can tell when a diarthrodial joint is a diarthrodial joint right away by asking that first question: is there a joint cavity present? Diarthrodial joints have a joint cavity. So, if you look at this kind of, it's just kind of like a generic, they're just basically showing a generic joint here. They're not really showing a joint in the body, but you have a joint cavity. It's a joint space, okay? If we look at the elbow joint, okay? Now some joints don't have as big a joint cavity as others, but it's still a joint cavity. There's still a space. So if we look at the elbow, okay, so the humeral ulnar and humeral radial joints, okay, they both make up the elbow, okay, there's a joint cavity there, okay. You also see there's a fibrous membrane and a synovial membrane. So if you look over here, they kind of demonstrate that. Again, this is just kind of a kind of generic joint, if you will, okay. There's the fibrous capsule, there's the synovial membrane that lines it. Okay, you have synovial fluid on the inside of the joint. You have your articular cartilage. Okay, so articular cartilage lines the bony ends, and that gets nourished by the synovial fluid. And these are freely movable joints. Okay, so we ask, is there a joint cavity present? Yes. Does it move? Yes. How much movement takes place? Well, they're freely movable. Okay, so that's your kind of your continuum of if you will, going from stability to mobility, okay, starting with the joints that are most stable, the synarthrodial joints and the different types of joints you have with that, going to the ampiarthrodial, which is kind of the balance between the two, and then the diarthrodial, which is the freely movable. So when we start to look at joint surfaces, so again, this is going to be important because we're going to be talking, and again, because this will be an extended discussion that gets in, we start to break down into the other body part regions. This is going to be important to understand movement. You have two general types of joint surfaces, okay? You have ovoid joints, okay? And all an ovoid joint is when you have a convex surface and a concave surface, okay? So if we're talking joint surfaces, okay, and always think of, when you hear concave, think of a cave. So like a lot of your fossas represent concave surfaces. So the glenoid fossa is a concave surface for the convex humeral head, okay? That's an ovoid joint, when you have concave on one side, convex on the other. A cellar joint or a saddle joint is when you have concave and convex surfaces on each side, okay? So if you kind of look at this little picture with the blue and red surfaces, they're kind of showing you what the saddle joint at the carpometacarpal joint at the thumb, which is right here, what that looks like. Okay, so if you were to look at this joint, and sometimes I tell students, you know, as I'm talking about some of these things in biomechanics, sometimes it does help to look at models. So if you ever want to look at anatomical models, you know, just get in contact with me and I'll make sure you can look at anatomical models. But basically at this joint, you have a convex and a concave on each side. And that's what you're looking at here. So here's your convex, concave, convex, and then you have the same thing on the opposite side. Okay. Now, why is this important? Well, again, when we're kind of managing issues at the joint, okay, depending upon what everyone's going to be doing, okay, you have to understand the convex-concave relationship when you're talking about ovoid joints. And we're going to talk about why that is, because understanding roll and slide is going to be important when you're talking about those joints. And we've already talked about the cellar or the saddle joint. So two examples of where joint surfaces are present here. You have at the carpometacarpal joint at the thumb. You also have the sternoclavicular joint, which also has a cellar surface, okay? And even the ankle joint, when you look at it, when you look at the ankle joint as a whole, now the ankle joint gets classified as a hinge joint, but when you look at the surfaces, there actually are convex and concave surfaces on both sides of the ankle as well. So arthrokinematic motion. So we kind of talked about this already. We already defined roll, slide, and spin. So we're coming back to this really quick because we're going to look at what's called the convex-concave rule, and it's important to understand that. So remember, with roll, okay, so when we're describing roll, we talked about how when new points on one surface come into contact with new points on another surface, that's roll, okay? So in other words, if there are all little points on this, so say this is point 1, point 2, point 3, point 4, point 5, point 6, they're getting new points on one in contact with new points on the other. When you slide, one point on one surface comes into contact with new points on the other. So if this were to just slide, they're showing you here how the knee would extend in the open chain, or closed chain rather, closed chain, I apologize. So they're showing roll and slide. But if we were to just slide, this one point would only be coming in contact with the different surfaces. So if we just slid this back and forth like this, you'd have this one point that would slide here and slide here if you were just sliding it back and forth, okay? And again, spin is when one point stays fixed and rotates. Now, in all our joints, you have both roll and slide taking place. This is important to understand when we talk about joint dynamics. As we talk about on the next slide, we're going to talk about the convex-concave rule and what that means for joint surfaces. Okay, so when we look at joint shapes and motion, so again, here's where this is going to be, where those definitions become important, and it becomes important to understand. So you're going to kind of have to go back to your anatomy and look a little bit at some joint shapes. And again, as we get into this, this will become more important once we get into the body part regions. But for now, I want you to kind of understand some basics with this. Okay, so what we call the convex-concave rule is based on the shape of the joint. And this is going to be important for people involved in musculoskeletal, particularly for individuals involved in musculoskeletal rehab who have to do joint mobilizations, okay? So I'm going to describe the convex-concave rule, how it works, and then I'll give an example as to how it occurs. So The convex-concave rule. If the convex surface moves on the concave surface, the roll and the slide occur in opposite directions. Okay? Convex moves on the concave, roll and slide move in opposite directions. If the concave surface moves on the convex, the roll and slide move in the same direction. Okay? So that's how the convex-concave rule works. Now I'll show you a practical example of that. So here we're looking at basically the fingers. We're looking at the PIP, and this is representative of what the DIP joint is. We'd be looking at with the finger joints, okay? So here's the PIP joint. So you have the proximal phalanx and you have the middle phalanx. Now it's starting up here. So essentially what we're doing is we're flexing the proximal phalanx on the middle phalanx. Okay, so this is the starting point. This is where the bone is starting. So if we go from here to here, so if you look at this, so what surface is this? This would be the convex surface, right? This is the convex, this is the concave. Okay, so again, think of concave surface, think of a cave. Okay, so here's the convex. Okay, so we know the convex is moving on the concave. So here's step one. Again, do this in steps the first time you're doing it, because again, it can be confusing. Which surface is moving? That's step one. So you know the convex is moving. That means the roll and slide have to occur in opposite directions. Okay, so in this case, okay, so here's where the bone's starting. Here's where it's ending. The roll, okay, you have a posterior roll, this would be moving posterior, and an anterior slide, okay? Everyone, so see that happening, okay? You would have an anterior slide and a posterior roll. If we come over here, okay, now what do we have going? So again, here's the distal phalanx, this is where it's starting, it's going from here to here. Well, what surface is moving? Now your concave surface is moving. So again, before you do anything else, you know that the roll and slide have to go in the same direction. So if you look here, that's what's happening. The roll and the slide are happening in the same direction. Okay? Again, first you have to be able to understand what roll is versus what slide is. Okay? They're going to happen in all our joints because that's how our joints stay together. If only slide happened, the bone would slide right off, okay? You wouldn't have any stability there, okay? So that's the convex-concave rule. We're going to go through more examples of class, but think about, again, at each individual joint, how that would be impacted, okay? Functional activity of joint axis. So it's important to kind of note that the center axis of the joint kind of changes during human movement. So in other words, our joints, even when we talk about hinge joints, our hinge joints, while, they kind of function like a door hinge would, they don't act the same way. In other words, they're not a fixed shape, okay? If that were the case, we would be very limited in our motion. So because our joints aren't totally congruent, I mean, they're congruent to the point where they maintain stability, okay? And what I would tell you is, if you were to flex all your fingers into your palm, notice that all your fingers don't just point straight down, okay? If you look at your little finger, it kind of points, it almost kind of comes off and starts to point almost in the direction towards the thumb. Actually, all your fingers, if you ever look at you just kind of flex all your fingers and have them point down, they all point at the navicular in your wrist, okay? So they don't just point straight down, they all kind of come off into an angle, almost more to the radial side of the wrist, okay? Same thing with your elbows. When you flex and extend your elbows have what's called a carrying angle. Okay, what that does is it just gives you more range of motion. Okay, so we have what's called an instantaneous. So in other words, as our joints are kind of rotating, all this means is that as our joints are moving and going through a range of motion, the center of the axis of rotation is always changing. Okay, so there's an instantaneous movement. So what they're depicting in this picture is the knee. So in other words, as the knee goes through a range of motion, the center of that joint axis does change slightly. And all this does is it kind of gives us some greater overall motion when we're doing things. And then the last thing we're going to kind of talk about as it relates to kind of like joint surfaces, closed and open pack positions, okay, and what they mean. So closed pack position is essentially usually at the extreme end ranges, and what closed pack positions are when the joint surfaces are most congruent or most together. This is when the joint is at its most stable, okay? So, you know, that, and again, it's usually going to be at extreme end ranges, okay? So for instance, the closed pack position of the knee is when it's fully extended, okay? The closed pack position of the elbow is when it's fully extended, okay? The open pack position, also called the resting position, it's typically at mid-range, not always, but typically. That's when the joint surfaces are kind of the furthest apart and when there's the most kind of joint play at the joint, okay? So those joint surfaces aren't kind of bound together. They're not held tight by the soft tissue. And that's where you're going to get some greater motion. And again, usually this is at mid-range, okay? So that's an important point to note. So now, again, the reason why this is important is because, again, when you're kind of dealing with, again, joint activity and things like that, for instance, when we do joint mobilizations, okay, so as an athletic trainer, when I would be treating patients and I would do joint mobilizations, I would always start with the joint in the most open pack position, okay? The reason being is I want to get as much, as I'm mobilizing a joint or I'm kind of working on those arthrokinematics, I want the joint to be as open as possible so I can move the joint, okay? Another example of this where the closed pack position is a little bit better is when we, you know, for instance, as an athletic trainer, when I would tape an ankle, I always want the ankle to be dorsiflexed as much as possible because dorsiflexion is the closed pack position of the ankle joint. That's the most stable position. So obviously if I'm taping somebody, I'm taping them because they have some degree of instability at their ankle. So I want to put them in that closed pack position. Okay, those are some examples of that. So these are your learning outcomes again. So again, these are kind of good things to look at when you're studying to make sure that you will kind of get some of the different things as it relates and kind of allows you to sort of organize yourself a bit. I will be kind of going through some other examples of some of these things in class, but make sure that you, bring some questions with you if anything needs to be cleared up.